pressure, what is it actually doing? Any guesses? It's early, I know it, I'll help you, okay? So we have a canister, right? And that canister is going to be collecting what from the wound? That drainage, that exudate, infectious material, all that bad stuff that we want to get out. This vacuum suction device is what's pulling all that exudate, debris, infectious material out of that wound bed, okay? So that's one of the, primary, responsibilities of negative pressure. Secondly, it is reducing inflammation, edema. It is working to generate granulation tissue, right? The whole point of negative pressure wound therapy is to accelerate that wound healing process. So as it's removing all that infectious debris, it's also allowing for perfusion to take place. So we're getting all that good, healthy stuff, that oxygen and those nutrients to the wound bed to help facilitate new tissue growth, okay? With that being said, can you guys help me out and tell me what type of wounds would be appropriate for a wound vac, wound pump, negative pressure? Those words are used interchangeably. What kind of wounds do you guys see that is appropriate for this device? Pressure ulcers, that's a huge one, right? So our chronic pressure ulcers, so those are stage 1, 2, 3, and 4. Just as a side note, the ones that are appropriate for negative pressure would be those stage 3 and 4, right? Because those are going to be, where you're seeing the depth of that wound, okay? Surgical wounds, very appropriate for negative pressure wound therapy, okay? What about your diabetics? Where are we seeing some of their wounds? The foot ulcers. So you've got diabetic foot ulcers on the bottom of the feet. There are venous insufficiency ulcers, arterial ulcers, trauma, surgical. All of these types of wounds are appropriate for negative pressure wound therapy, okay? So when you're encountering a resident on this device, most likely they have one of those type of wounds, right? So let's talk about the device itself. This here is the device that you guys have here in your facility. This is called the Nisus pump, okay? We don't use the word wound vac, we use pump. Our competitor kind of coined that term wound vac, but again, the same type of device, right? But one thing I always like to point out with this pump being newer, so we went to market with this in 2016, I'd like to mention that because of the newer technology. We were able to pack a lot of power into a very small device. So you guys may have seen, larger devices on the market. If you've ever worked with negative pressure wound therapy, you may have seen, even in like an acute care facility, some larger pumps at the bedside. Has anyone experienced that before? Right? Big pumps, big canisters. Well, this device actually does the exact same thing as those large pumps. We were able to pack a lot of power into this little device. So when I'm talking about power, I'm talking about suction capacity. So the suction capacity of this pump is 8 to 10 liters full per minute, okay? That is equivalent to what you would see in those larger pumps at the bedside for complex wounds in the acute care environment. But we were able to do that in a smaller pump. And I like to make a note that this pump can actually start in a hospital setting, take care of those complex wounds, higher exudating wounds because of its power, and it can go with the patient into the post-acute setting, in the SNFs, and into the home setting. So we designed this pump to go with that patient through the continuum because it is so portable. So once they get to a place where they are ambulatory and they still need their therapy, and they're going to the grocery, and they're going to church, and they're at home, they can still use this device because it's so small and portable, and it comes with a little carry case. And we see a lot more compliance from this patient population because they're on a small unit, it's lightweight, it's quiet. So we know that they're able to continue that therapy without stopping that therapy because of loudness and interruptions. Yeah.
So to fill you in on the full circle here, a patient can be placed on that pump in the hospital, come over here still on that pump, and maybe even discharged home on that same pump. So we can bill Medicare, and we have a resident going home today. Medicare will allow for 15 dressings per month and 10 canisters per month. And we get all that documentation from Dr. Lynn or any of the providers. But again, like we build a hospital facility for the pump, patient goes on it here, to the nursing home, to home. if need be. There's no break-in service.
And I have a friend that's Olympic.
Okay.
Yeah.
And doing the basketball with that attached.
Oh, yeah.
Oh my
To
gosh,
me is
wonderful.
amazing.
It
Yeah,
is
it
amazing.
is.
It is amazing. No, great,
Yeah.
great. So before I even turn this pump on to show you some of the features, let's talk about the canister, okay? We started off talking about negative pressure, that vacuum suction. It's going to be removing that exudate and infectious material from the wound. Has to go somewhere. That's what the canister is for. It is a disposable product, so this is something that gets thrown away once it gets full, okay? So just like Kenny said, you know, in the home environment, you know, they're allowed 10 of these a month because they may be going through them, okay? In your facility environment, when it's full, we change it, okay? They do last one canister per week, or if it gets full first, then we change it then, okay? I'm going to show you just proper application or installation of the canister to the device. It's very, very easy. You know, we made sure that this pump was user-friendly from a canister standpoint to navigating the pump and troubleshooting, okay? So when we go to put the canister on, you guys are going to notice that there's this little plastic piece here. There's a little indentation or groove on the side of the pump. It's kind of like a puzzle piece. You're just going to match that up, and you're going to push that forward. It is that easy, okay? This tab here on the side to remove the canister, you pull back on that, the canister comes off. So if you're at the bedside, this pump is alarming. You see that the message says canister full. You absolutely can jump in and handle this. Pause that therapy, actually turn that pump off. You grab, or you actually clamp off the tubing, right? You pop off the canister, dispose of that. You're grabbing a new one, putting it in place, and make sure you unclamp that tubing and start therapy. That is how simple it is. A couple things about the canister. There's some things in there. One is a solidifying agent. So when that thinner viscosity exudate comes into the canister, when it hits that packet, it actually pops open and it creates more like a gel-like consistency in the canister, okay? So the correct orientation of this pump is upright, but let's say it gets tipped over, you know, with that thicker viscosity and that gel-like consistency, it's less likely to get to a point or a sensor in the pump that tells the pump that the canister is full, which would be a false canister alarm. We want to reduce that from happening, which is why that packet is there. One other point I want to make about the canister, there is something built into this called a hydrophobic membrane, okay? The reason for that is as drainage is coming into this canister, we want to prevent it from egressing into the pump, meaning we don't want this patient's infectious material inside the pump because this pump is something that we clean, disinfect, and use on the next patient, right? So we can't have that. We have to make sure that all of that drainage is contained in this canister. That hydrophobic membrane allows that to happen like that, okay? It does not restrict flow, okay? It allows for flow, but it also prevents fluid from getting in the pump. All right. Another thing about the canister, you'll notice that the tubing is pre-attached, okay? I like to mention that because there's other manufacturers out there where the tubing comes separate and you have to assemble it, okay? We make it easy. Also, a little side note, this tubing is made of silicone, very, very soft, very flexible, pliable. We did that because if a patient were to accidentally roll onto it, maybe they're laying on it, we really want to reduce the chances of a pressure-related injury from medical device, okay? There's some out there that are actually a lot thicker, made of nylon, a little bit harder. If a patient were to lie on that over a period of time, they could cause some pressure-related injuries. So we're very selective on how we produce and manufacture the tubing, as well as some other items with the pump. All right, I'm gonna go ahead and power on the pump. I wanna show you guys what you're gonna see when you're looking at the device. And it's a universal power button here, right? And as soon as you turn this pump on, you guys might not hear it, but right up here, I can hear that motor revving. And that's because this pump goes right into therapy mode. You do not have to look for a start, play, run. It's happening. You turn that pump on, we know therapy is running, okay? I'm gonna go ahead and clamp it off just to quiet it down here, just to go through a few things, okay? The first thing you might notice, because it's in big and bold, is that 125. That is the millimeter mercury pressure, and that's what the pump is set at, okay? Now we can make that change. The physician comes in and says, you know, we need to increase that millimeter mercury up to 150. I'm gonna teach you guys how to do that. But you'll always know exactly what the pump is running at based on what you see here on the screen, right? A couple other things you see on that main screen. Here, top and center, date and time. And then over to the right here is the percent battery life. Very similar to a cell phone. It's always telling you how much percent battery life you have left. I'm always encouraging when that resident is in the room and we are close to that power outlet, let's keep these pumps plugged in, okay? They do have up to a 24-hour battery life. However, it is nice to keep them fully charged in the event of residents going to activities, they're ambulatory. We want to make sure they have that full battery life as much as possible. If that battery life is drained or close to zero and it's time to plug that pump in, it does take 2.5 hours to get that full charge back up. Of course, you continue therapy. We're not interrupting therapy, but just know that it does take 2.5 hours once it's plugged in. When it is plugged in, a little blue indicator light is going to pop up as well to let you know that that pump is charging. All right. Couple other things I'd like to point out on this main screen. To the right of that 125 is a little picture of a padlock. And right now it's in that unlocked position. And at any time, if you'd like to lock the pump to make sure that your patient or anyone else can't accidentally make some changes by pushing some buttons, it's always nice to lock that screen. So in order to do that, you'll see down below here, there's some arrow buttons. There's an up, there's a down, there's a right and a left. We're going to use that to navigate through some of the menus. But on this screen, to lock this pump, I'm going to hold down on that up and down arrow button for just about 2 seconds. And my little padlock, the picture of this lock, has now gone from the open position and you'll see it locked. So the little picture tells you it's locked. Now if I go to make any changes, I can't. Let's say you're the one that is going to be working with a pump. You need to make a change to that setting. You saw that physician order and you see the pump is locked. What you can do is unlock it pretty easily by holding down on up and down arrow button. Couple seconds. Now it's gone into the unlock. So you can always just look at that picture and see, is my screen locked? Is it unlocked? Okay. Opposite that, if I hold down on the right and left arrow button simultaneously for just about 2 seconds, I get a little S, sorry, I'm upside down here. I get a little S that appears in the lower right-hand corner of the screen. That stands for sleep mode. You ever have a resident say, hey, at night the screen is so bright and I have to put a blanket over that or a pillow so I can sleep? You can actually put the pump in sleep mode. Once you have that S appear, about after a minute, that screen will go dark. Okay? That dims everything for the patient. Now, therapy is going to continue to run. We're not shutting down therapy. It just shuts down that screen. And then in the event that the patient needs to see what's going on, or you as a clinician want to check what's going on with the pump, you can hit any button for it to awaken, okay? Another little side note that I like, when you do put it in sleep mode, it saves on battery life, okay? So if one of those residents, they have one of those trickier wounds where the pump's working a little bit harder to always maintain that seal, it may drain that battery a little bit faster, but with sleep mode, it preserves some of that, okay? All right, right below the 125, it says runtime. The runtime is actually accumulating the number of hours and minutes that the patient's on therapy. It's great for you guys as a compliance check. If you have a resident that's on therapy and you're thinking, is my resident turning their pump off during the night? Is there a compliance situation here? You can actually double check by looking at how many hours has this pump been running. There is a way in our settings menu to zero that out. So I'm going to show you that here in a second. But I absolutely love that. It is a great way to check and see what is going on and how many hours that patient has been on therapy. Because as you guys know, this is a continuous therapy. We don't want to interrupt therapy. It is a 24/7 type of therapy. Okay. My sleep.
We had a conversation last night too. When we deliver these pumps to you guys, we are going to reset them at the beginning of every time upon delivery. So we'll already be at 0 So you guys can actually see when you put on the pump the next day how many hours and minutes the patient has been on that therapy for.
Perfect. Okay, we've kind of gone over what you're seeing on the very main screen. I'm going to hit our menu button so I can show you what you have access to and what kind of changes you can make with this pump. Right in the center of all our arrow buttons, which is what we're using to navigate, there's a button in the center that's called menu, okay? It's kind of used as our menu button, and it's used as a select button to select what you want, okay? So I'm gonna go ahead and hit that, and it takes you to a screen with 4 different icons. The very first one, it says therapy mode. It's already highlighted. This one you probably would use most out of any of the others. The therapy mode is where, like I said, if you see a new order, you know, it was at 125 and the physician says, nope, we're gonna increase that to 150, then you can go in and actually make that change very easily, okay? So once it's highlighted, which it already is, I'm gonna use that middle button to select it. And right here, and I know it's hard to see, but I'll kind of walk you through it. It says target pressure. So I'm highlighting the target pressure and it says 125. So obviously this is where I'm gonna make the change. And it shows you the arrow going this way if you wanna go up and increase that pressure, and the arrow this way if you wanna go down and decrease that pressure. So let's say we wanna take it from 125 to 150. I'm gonna use this up arrow button, and I'm gonna push it 5 times. And the reason I'm pushing it 5 times is it increases and decreases in 5 millimeter mercury increments, okay? So to go to 125, I'm just 130, 140, 130, whatever, it's early, 35, 40, 45, 50. Okay, once you get to 150, you select it with that middle button there, and it will ask you, do you want to accept these changes that you just made? I'm selecting that, yes I do. It goes right back to that very first screen, and you can see the change we just made to 150. Very, very simple. You guys, once you play with this pump, you will see how user-friendly this is. Really just navigating around and kind of finding what you need. It is very, very simple. Okay?
Do you see the bulk of your orders at 125?
I've
Yeah.
never seen the 150.
Yeah.
Right.
It's good to know that you can.
Yes. And it can go from 40 to 200.
Really?
Yeah, absolutely. Yes.
We typically see 80 or 125, and 80 most of the time on a closed surgical site that they're just trying to maintain patency and keeping it closed. But 125 is like industry standard. The only time it would change to 150 is if we called the surgeon and said, hey, ABC, XYZ, or the physician, and they would say, okay, up it to 125 for so many hours, then back it down to, up it to 150 for so many hours, then back it down to 125. But a lot of them don't like to do that, quite
Sure.
honestly.
Yeah,
They found
sure.
at 150 it destroys more tissue than it actually helps granulate. So
Yeah. You probably won't have to make many changes. The pump is going to come already prepared for you at 125 continuous, which is what we see as
Hit
the
the
most
power
common.
button.
Yeah.
Yeah, exactly.
That's awesome.
Okay. Couple other things. Let's go back to that menu. Okay. I want to show you what you can do in a settings menu. So if I highlight that by navigating down to it and select it, in the settings menu, it gives you a list to choose from. Number 1, you can change the language. So this pump can be in Spanish and English, and you can just toggle to make the change. You can change the date and time at the top. This is where you would actually zero out that runtime display. So this might be something George uses, is if he's doing a dressing change on a Monday, he may want to zero that out. So on Wednesday, we can see, are we close to around that 48 hours of therapy, by looking at that runtime. So he may go in and just say, you know what, I'm going to zero that out at each dressing change. And all he has to do is navigate down to where it says runtime reset, use that select button. It says, do you want to accept these changes? Yes, I do. And when you go back to the main screen, that runtime now says 0. So now it's going to start that accumulation of hours and minutes all over again. Okay? Just some fun little tricks. Okay, another great feature that I absolutely love about this pump is that the troubleshooting menu is built right in. So when I say that, what I'm meaning is all the alarms that all pumps have, regardless of the manufacturer, such as leak alarm, blockage alarm, canister full alarms, we all have them. But what most pumps on the market don't have is a troubleshooting menu that actually pops up and gives you instructions step by step on how do I fix the alarm? How do I overcome it? How do I troubleshoot it? This pump does. So you guys will love this. So I'm going to go into the menu to actually pull it up and show you by navigating to it. Now, real life situation, when you get that alarm, it's going to do it for you and pop right up on the screen. You don't have to find the instructions. It will be there for you, okay? But let me just show you what it will look like, okay? So your pump is alarming. You go to look at it and you're like, oh, it says there's a leak alarm. What do I do, okay? Well, it'll tell you what to do. It actually says, number one, inspect the drainage canister to make sure there's no visible cracks. You know, did this get dropped? You know, did the canister get a crack in it? If so, that's going to let air in. We've got a leak alarm. You would know to change the canister. If that's not it, you go to number two and it says, let's ensure that the tubing, the port pad tubing, is connected to the canister tubing and it didn't come undone, okay? Make sure it is correctly fastened, okay? So you're going to check the tubing, inspect that. Hey, that looks good. I don't have a leak there. And then finally, it says, listen for air leaks around the dressing. So it's like a look, listen, and feel. You go to the dressing site and you start listening. Do you hear that hissing sound? Do I have some air getting in? Does some of that acrylic drape pull up somewhere? You know, is there some sort of leak at that dressing site that I could look, listen, feel, and do some patchwork to overcome that leak and continue that therapy? Okay? Another one, just quickly, that I like to show is the blockage alarm. Okay? So I just highlighted blockage there. In the event of a blockage alarm, you're going to hear that beep, beep. It'll say blockage. What do I do? Well, number one, it says, let's ensure that both clamps are unclamped. Maybe we did like a quick canister change and we forgot to unclamp it, okay? So you're gonna check the tubing, make sure it's unclamped, because if it's not, after a couple minutes, it's gonna say, hey, blockage alarm. So this is how you would fix that, okay? It's also gonna tell you to inspect the tubing itself for any kinks, okay? You know, did something get kinked somewhere? Did it get pinched in a wheelchair or something like that, to where you can inspect that, unkink it, problem solved, right? And then lastly, it'll say, check the port pad. So I'll show you this when I do a dressing, but is there a lot of pressure that's being sitting on that port pad that's causing a blockage right at the site? That could be a potential. So you guys get the idea. The pump is actually going to walk you through and help you to troubleshoot any of these type of situations. Okay? Any questions so far on what the pump can do? Pretty easy, right? User friendly. George.
I have a question. You may have gone over it, and I apologize if I missed it, but can you let them know what it's set at and what it's suctioning at? That's important for troubleshooting, because a lot of times you can't always hear. And yet if you can see that there's a discrepancy, you know that there's a leak and you know that you need to look at it.
Oh, no, great point, great point. Some pumps out on the market have what you call as a leak detector. So you do an application, you're like, do I have a good seal or is it detecting a leak? So our pump, a little bit different, rather than a leak detector, you can actually see what is my actual pressure. I know what it's set at. It's set at 125, but is it actually reading at 125? So to do that, you go right into that therapy menu, just like we were before, okay? Because we know that's where our target pressure is set, and what I have it set at 150. Right below that is the actual reading, that current pressure, and it says 150. So if those match, my order was one for 150 or 125, and it says that I'm at 150 or 125, you've got a perfect seal.
I don't know. So the backside, I remember we were using, it had like, it's kind of dealing with like that kind of stuff. It had the I'm trying to think of how one word, the colored raising the bar thing. Like if it's a proper seal, it would be like all green, 3 bars up. And
Oh,
if
yeah.
it wasn't, like it'd be red or yellow to kind of
Tell
show
you.
you. And it was like in that main menu, like where it shows like what your suction is supposed to be set at.
Yep.
Is that something like that, or do you have to go through this
Absolutely.
whole setting, like clicking that, or is it showing on the main screen?
It doesn't show it on the main screen, okay? But by just going into that menu and hitting that therapy button, it's on that screen.
Okay.
So you just
It's
go
the
in there to
exact same
double check
idea.
yourself.
You do have to go in and find it. This is actually better because it's telling you how many millimeters of mercury that's actually being suctioned versus the red and
Good or
green.
bad, right?
Yeah.
So it actually
Yeah.
gives you a really clear indication.
That was the Genodyne pump that
Yeah.
we used to have.
Okay. I don't recall seeing that one for a little bit now, but
It's
No,
been
we're under the
probably,
Nisus.
probably about 2 years now that we switched to Cork.
So I'm gonna pause there. It looks like breakfast is ready and we're gonna do a dressing application. So why don't you guys all grab something and then we'll prepare to do this last step. We'll take a quiz and get you out of here.